So I have Ruby, who is almost 16 and has Down syndrome, and my son Grady has autism. He's 13. And personal care services for them is anything that their daily tasks that they're unable to do themselves that a typical 13 or 15-year-old would be able to do. So, for example, cooking meals and eating meals. Ruby is not able to use the stove safely. The microwave as well. She needs help setting the time. Oh boy. Okay. That's good. You can see why she doesn't cook herself. To eat her meals, she needs help cutting food, and sometimes she takes too big of bites, so I help her, just remind her as she's going to chew and, just be safe while she's eating. So that's just something that a typical 16-year-old wouldn't need help with. Then other tasks are dressing, making sure clothes are on the right direction and clothes are appropriate for the season, helping them with their laundry. Neither of them are able to completely do their laundry themselves, or a lot of kids may not do that, but my kids don't have the skills to follow that task. My goal is to help them be as independent as possible when they get older, so I could be providing these services, just do it for them, but I try to have them help me so that they're learning so they won't be so dependent. Depending on the individual's needs, they get assessed a certain number of hours. Every year we have a review with a nurse, and we go through the skills and developmental area of each of my children, and then they assess a number of hours per week that they're allowed to have these personal care services provided for them. So like for example, Ruby has 35 hours, and if that's like a Medicaid authorization, the nurse said this is how many hours of help she needs. If I can't find somebody to provide those hours by July 15th, then they're going to cut off the authorization and say Ruby's no longer authorized for those hours as of July 31st. So if I, in the future, find someone, then I have to go through that evaluation process again and get her authorized again for hours. Like prior to this, I didn't have a worker. I didn't know anyone who could do that. And when I found out I was able to do it myself, I went to the agency and I took the testing and I did it myself. The program grew so quickly, and Health and Welfare probably wasn't quite prepared, didn't have the infrastructure in place to put, to safeguard against fraud. So if those things aren't in place now and we all find new workers, there's still going to be fraud if they don't put the safeguards in place to protect against that. But the problem is, in January of this year, when we were all writing letters and trying to save this program, the work group that had been working with Health and Welfare on this program, they did a survey of all of the agencies in Idaho, and 90% of the agencies that employ these personal care workers like myself said they do not have staff to replace us. So if 90% of the agencies couldn't replace the staff, then that's going to be a lot of people losing services that they're actually qualified to receive.